My name is David Wortley. I'm the Vice President of the International Society of Digital Medicine, and it's my pleasure to talk to you today about digital health, nutrition, and healthy aging. So, what I'm going to be talking about today is some of the solutions that are currently available to support healthy active aging, in particular with a focus on diet and nutrition. And in order to do this, I want to begin by creating or going through some of the background to the issues that are facing us in today's society. The first thing to recognise is that our life expectancy has increased enormously during the last century. And today, because of advances in technology and medical practice, we can expect to have a longer lifespan. But with this longer lifespan, there are associated difficulties because as we get older, as you all know, we do require additional care. And that places a greater burden on public health services. And this is exacerbated by the fact that with the increasing longevity of the population, there are fewer and fewer working people able to generate the resources and income in order to be able to support this aging population. The other factor to mention, which is something which has now been kind of skewed a little bit by coronavirus, is the fact that over the last century, because of these advances, we have shifted away from primary causes of death being related to communicable diseases, as they were a century ago, to most causes of death related to non-communicable diseases. And these non-communicable diseases are largely as a result of modern lifestyles. As I say, coronavirus has skewed these figures a little bit, but the conclusion is still valid. And this is verified by looking at the leading causes of death over the last 20 years. And you can see things like cardiovascular disease and cancer and a whole range of other non-communicable diseases are the primary cause of morbidity these days. And these are directly related to our lifestyles. So there are many different challenges with getting older. And because these challenges are based around non-communicable diseases, which are linked directly to our lifestyle behaviors, then we do need to do something to address behaviors. And we need to do that at an early an age as possible. And I use this example for an example of the challenge of the aging society, which is a picture of my mother when she was in hospital before she sadly passed away some 10 years ago now. So we're living longer. We need more medical care as we age. We're going to have fewer working people to cover the costs of that care. And society is changing exponentially. And one of the problems behind the current coronavirus situation is the fact that we have greater social mobility. We travel a lot more in our lives, or we have traveled a lot more in our lives. And all of this leads to problems with unsustainable public health resources and the fact that social care as we become elderly tends to be a poor relation of public health services. And coronavirus has simply really brought into focus and exposed our vulnerability to the unsustainability nature of public health services. So what can we do about it? We have a number of different choices. And these choices relate to different kinds of strategies. We can develop clinical cures, as we have done successfully, to tackle coronavirus. Vaccination and drug treatments have reduced the probability of death from coronavirus. But if we're going to influence personal behaviour, we also have to look at other approaches. And governments all around the world are using a carrot and stick approach to behavioural change. And we also, in the background and in parallel, are developing solutions which help with our personal health management. But this also depends upon our willingness to accept responsibility for our own health. Now, technology has had a paradoxical impact on healthcare and healthcare, the way in which we perceive healthcare. On the one hand, we are comforted by the fact that technology is advancing all the time, and we're finding more and more rapid ways of solving our health problems. So in a way, it doesn't encourage us to take responsibility for our health. On the other hand, we could say that technology is a fantastic tool if we use it in the right way, and we use it to empower ourselves to improve our personal health and take greater responsibility, knowing that we've got the tools today to measure our health and measure our lifestyle behaviors and their impact. All of these advances in technology have also had a paradoxical effect on the locus of control, which is how we see our level of control over our lives. And research has shown that our younger generation feel that they have less and less control over their future and their lives. And in a way, technology helps to exacerbate that problem because we become increasingly reliant on the tools that we have in the shape of smartphones and devices. And these devices are not just used to provide us with advice and guidance, but increasingly they take away some of our ability to make decisions, and hence we have less control over our lives. But the fact remains that if we are to have a sustainable future and healthy aging society, we do need to make this shift away from curing disease to preventing them in the first place. And this is a big challenge. And the challenge is, how can we influence lifestyle behaviors and circumstances, not just at an individual level for ourselves, but also at scale globally. Now, one of the ways in which we can do this, and this is how I started on the journey some 8 or 9 years ago, is to look at how mobile apps can help us to manage our own personal health better. I started off with a device called the Jawbone app, a wearable device, which not only measured my physical activity, my steps and my sleep, but it also enabled me to record my diet and my nutrition and keep track of them, and even rate all of these areas of my life with different scores. And that's the screen that you see on the left-hand side. And this kind of approach of providing data which allow us to track the key metrics which influence our personal health has been the backbone of most fitness trackers and health apps today. And these work, and I'm living proof that they work. And I can show you some images of myself taken over the time span. Prior to 2013, when I started to look at my own personal health, you can see that I was really quite obese. And it was just a series of really coincidental events that led me to see if I could gamify my own health and use technology to help me choose a better diet, to be motivated to exercise more, and to see what kind of impact that had on my health. And you can see between May 2013 and September 2013, over a period of 3 months actually, I was able to lose 21 kilos, and I observed firsthand an amazing transformation in my health and well-being, not just physical health, but also mental health and zest for life. So what I see as being the future of technology in this area is the ability to technology to help us to provide a personalized, gamified, and importantly, validated behavioral change. So these are the key health and well-being influencers to which technology is being applied today. So we've got diet, exercise, hydration, sleep, mindfulness and stress management, and also importantly, a network of social support. So these are the things that influence our personal health management. And if we're going to do this, then the technology has to be able to deliver a number of key steps. First of all, it's got to be able to measure those key influencers within our lifestyles. It's got to be able to create personal benchmarks for us that allow us to effectively measure our progress. It also has, if we're going to influence behavior, to set goals which are achievable. In my case, it began with 10,000 steps a day. All of this will be of no use if there isn't a supporting environment, because the domestic situation that we find ourselves in is often responsible for some of the barriers to being able to comply with a healthier lifestyle. And technology needs to provide some digital therapies. It's not a question of advising on drugs that we need to take or supplements. We need to be able to use technology in a practical way to have a genuine influence on our lives and our personal health. And finally, it should really encourage personal responsibility and motivate us to look after ourselves. So I'm going to now look at the way in which technology has developed, particularly in the area of diet and nutrition. So with the Jawbone app that I began with and the Fitbit that I currently use, I describe these as almost first generation applications when it comes to diet and nutrition. They encourage and they track our exercise, they record our sleep, but they also provide an opportunity, if we record what we eat, to calculate the macronutrients and calorific intake that we've had and balance that against our metabolism and how many calories we burn through our exercise every day. And these days, these types of applications like Fitbit, they also offer recipe suggestions. And I've shown a few screenshots here that begin with the dashboard that gives me a complete overview of my heart rate, my sleep patterns, my activity, etc., the amount of hydration that I have, and my calorific intake. And this calorific intake is broken down into macronutrients, but I have to record, and I have to be reasonably honest in the way I record this. I have to record everything that I eat. And what my Fitbit application does is provides advice through a variety of web pages that helps me to understand how the calorific values are calculated, but they also provide some additional dietary suggestions. So I describe this as a first generation application. The second generation application is taking us down the road towards a more personalised approach to healthcare, and it uses epigenetics. An example of this is an application, mobile application called Muhdo. And what happens with Muhdo is that you send off a sample of your sputum to analyse your DNA. And from this analysis of your DNA, Muhdo helps to calculate an optimal diet and exercise plan. And it then translates this into offering advice for diet, exercise, and nutrition. And again, I'm showing you some screenshots from Muhdo. So it begins by looking at my genetic profile, and it's showing how I react to different types of food. And it translates this into a series of health insights to tell me what I can expect and the particular characteristics that are prevalent from the analysis of my DNA. And this is in the form of a personal profile. It also calculates my genetic age compared to my physical age, and I'm happy to report that although now I'm 72, my body is actually 68, but that isn't a uniform age throughout all parts of my body. There are certain aspects where I am older than my physical age. In fact, my eye age is significantly older. So what Muhdo does is takes this information and it gives me an opportunity to input some details about what my kind of aspirations are health-wise. What is my focus? Is it on health and well-being? Do I want to increase my muscle mass? Do I want fitness and endurance? And I have to supply some basic information about my current activity level. And what Muhdo will then do is to translate this into a diet and nutrition regime in the form of personalised advice. So it goes a little bit beyond what Fitbit can do, and it is more personalised to my genetic circumstances than Fitbit is able to offer. But of course, today, we have only had these technologies for a few years. They are still quite embryonic in many different ways, and a lot of older people are suffering from real challenges with co-morbidity. And as an example, I'll show my partner's late father, who lived with us for a year. He passed away last October. And Eric Jepson, until he was put onto a new end-of-life drug regime, had to take a multiplicity of bewildering array of drugs every day to manage his condition. Fortunately, he didn't suffer from dementia. Even towards the very end of his life, his memory was still intact, even though his body was giving way. But this comorbidity problem has to be factored in when we're looking at diet and exercise. So I now just want to show an example of what I describe possibly as a third generation application, which is not a commercial product. It's a proof of concept application developed by a company called PrecisionLife, who are big data analytics and genomics specialists. And what they have been able to do in this proof of concept is to take into account medication and reaction to medication, and use DNA and genomics to calculate optimal diet and nutrition. And in addition, importantly, can provide personalized advice actually at the point when you're purchasing food. So, as I say, it's a proof of concept, and this is a typical example of the scenario which this proof of concept is designed to address. There's a character called Albert. He has a series of medical conditions. He takes some certain drugs, and so the challenge is what kind of side effects from diet and nutrition might he have? When should he call his GP, and what is safe or good for him to eat? So it's factoring in this additional medical condition and drug regime into his advice. So it results in this proof of concept project where you're looking at a number of different interactions that take place with comorbidity. We've got drug to drug, drug to disease, drug to ingredient. There's various allergen responses. And so what this does is translates all of the information using big data to provide a personalized dietary advisor. So it looks at Albert's personal profile. It has a huge library of food products and makes personalized recommendations, or even swaps from food that Albert loves to food which will have a good chance of him liking, but also be better for him. So this is how it might appear in a mobile app when he goes to a food store. It tracks the amount he spends. It looks at his shopping basket, and it calculates the value of that diet to his circumstances, but also it tells him what foods to avoid. And in this way, at the point of purchase, it's providing some tools to support personal health management. And it uses a gamified approach, so it's motivating and providing incentives constantly for Albert on the way. So in the future, I see this is not the ultimate end, but where I see that there are certain problems with using technology for diet and nutrition in a digital health format. And what we'd like to see in the future is an extension of this personalization of diet and nutrition based on epigenetics and medication. And through the use of AI and machine learning applications, we will develop technologies which will be able to recognize food on the table, cook food, and food when we purchase it, and calculate their nutritional value, so we don't have to manually enter all of these things. It will also encourage the development of personalized food delivery services. Already we are seeing companies advertising on television, delivering not just cooked food, but also food for home cooking. And these increasingly could be tailored to our personalized diet and nutrition plan. And I think also the thing that we will see is that with the increasing sophistication of wearables collecting biometric data from us, they will be able to assess the efficacy of our diet and nutrition, and alert us and shape our choices in the future. So we finish up with what I described as a personalized, gamified and validated health ecosystem. So whether it's exercise, diet, nutrition, hydration, etc., there will be a series of technology solutions which will help to diagnose, which will help to benchmark our profile, and will provide solutions for intervention. And these will be extremely personalized and linked to an ecosystem of health and well-being service providers. So if we are going to provide these digital health and digital therapeutics solutions for older citizens, we need to be sure that these solutions will address both physical and mental health. For older people, they definitely have to be plug and play, and there are some issues with today's technology for older people that don't exactly meet that criteria. They need to provide realistic challenges, but they also need to do that in a way which provides, which is not demanding, and which it has some intrinsic motivation, fun, for want of a better word. They will need to connect with the family and community, provide that network of support. They will also need to provide feedback and diagnostics to both motivate and track your health. And importantly, they need to give users control over their own personal health management. And finally, I'd just like to say that we need to change our perceptions about the ageing society. And far too often, and it's understandable, we see older people as a burden on society because of the cost of care in old age. I think we can make a positive difference, not only to the sustainability of our healthcare services, if we regard older people as an asset rather than a liability, and try to tap into their life skills and experience, which will have a very positive effect on their mental health, and I think also physical health and general well-being. So thank you very much once again for this opportunity to talk to you today.